bottom of the items.
A motion to adjourn the House is deemed to have been made and seconded at this time. Therefore, the question is that this House do now adjourn. The Honourable Member for Vancouver Quadra.
Thank you, Madam Speaker, and I'm here to speak about a question that I asked on September 30th when the good news was received throughout Canada that the Supreme Court of Canada had ruled that InSite, the safe injection site in Vancouver, saves lives and therefore cannot be shut down by this Conservative government. And I asked the government's health minister would she commit to stop attacking InSite and accept that ruling of the Supreme Court? And her answer was that she will be reviewing the decision. So I would hope that that decision has now been reviewed and accepted and will be followed by this government. Drug addiction remains a major health problem in Canada. There's no question about that. It costs Canada some $5 billion annually in economic costs, including health care, lost productivity, property crime, enforcement. In Vancouver, for example, an estimated 70% of criminal activity is associated with illicit drugs, and about 63% of federal offenders have drug abuse problems. So this is a major problem. And it's a health problem. We're beginning to understand now the neuroscience of addiction, and we now know that drugs actually change the neural pathways in the brain, so that it is very, very difficult for people who've become addicted to actually to let go of those addictions and to cease using the drugs permanently. There are changes in the brain, as with other neurological disorders. It's actually a health problem. So what the public, I would claim that the public wants government to assist in the humanitarian effort of saving lives. It wants government to take seriously the social objective of reducing drug addiction and the crime that's associated with it, and would like governments to pay attention to the fiscal concerns and responsible spending of tax dollars in doing so. And Madam Speaker, I would contend that this Conservative government is working against the priorities of Canadians and not getting the job done in terms of those issues. To start with, saving lives, the science is in. InSite saves lives, and there has been well over 20 peer-reviewed studies that have shown that. There have been 0 overdoses with the drug users who have been supervised at InSite, compared with, in 1 year, over 200 deaths on Vancouver streets in the downtown east side from drug overdoses. So it does save lives. And in terms of reducing drug addiction and reducing crime, it's becoming increasingly clear that treatment is a much more effective way to reduce crime at much lower costs. And that's why we're seeing legislators from Texas wagging their finger at the Canadian government and saying that our approach in Canada is just wrong. And for example, I heard in a committee 2 weeks ago that this government has spent $122 million increase in security costs to prevent drugs from getting into prisons, but at the same time has reduced treatment program availability to addicted inmates by $2 million. Why reduce those costs or treatment programs when that is actually the most effective way of dealing with the crime? So, for example, $1 spent on treatment will achieve the same reduction in flow of cocaine as over $7 spent on enforcement. So this government is doing it backwards. It's just not getting the job done, and is spending far more of our tax dollars with their failed corrections policies and their failed tough on drugs, drug war approach. And this InSite, fighting against InSite, as the Conservative government has done for the last few years, has been just a testament to their approach, which is ideology over evidence, costing more,
I must interrupt the honourable member, but she will have 1 minute later. The honourable parliamentary secretary to the Minister of Health.
Thank you very much, Madam Speaker. And I really do appreciate you giving me the opportunity to comment on this very important issue. The Supreme Court of Canada has made its decision, and although we are disappointed, we are complying with the court's decision. Our government is committed to addressing the issues related to illicit drug use here in Canada. A key pillar of our national anti-drug strategy is prevention and treatment for those with drug dependencies. Our government believes that spending money on treatment and support to help get people off drugs is the best investment that we can make. Since 2007, the health portfolio invested $577 million over the 5 years of the strategy's prevention, treatment, and enforcement activities. As part of the strategy, we have made significant investments to strengthen existing treatment efforts through the Treatment Action Plan. For example, we have invested $30 million over 5 years in a targeted mass media campaign. It raises awareness amongst parents and youth between the ages of 13 and 15 about the dangers of illicit drugs. Madam Speaker, studies show that this is a very important age when these messages need to get through. Right now, the youth campaign TV ads are on the air from October the 3rd to the 30th and will run again from November 7th to December the 11th. The mass media campaign has seen impressive results. For example, Madam Speaker, 25% of parents who recalled one of our TV ads have taken action by engaging the discussions with their children about drugs. That is great. There's also been an increase in the proportion of youth who say they know about the potential effects of illicit drug use on relationships and family and friends, with family and friends. Under the Prevention Action Plan, our government also funds health promotion and prevention projects for youth through the Drug Strategy Community Initiative Fund. I'm pleased to say that since the announcement of the National Anti-Drug Strategy in 2007, 103 such projects have been approved across Canada. This represents about $40 million in multi-year community-based investments. Madam Speaker, if we're able to save one child or family from the negative impacts of drugs, this will have been money well spent. I will conclude by stating our government is aware of the complex challenges faced by people addicted to drugs and the impact those drugs have on Canadian communities. We remain committed to working with provincial, territorial, and municipal partners to address the issues related to illicit drug use across Canada. Thank you very much, Madam Speaker.
Honourable member for Vancouver Quadra.
Well, thank you, Madam Speaker. And I just would invite the member opposite who is expressing a commitment to that the government, if it can save one child from the negative impacts of drugs, that they would do so. I would invite the parliamentary secretary to reflect on the fact that those people who in the downtown east side are addicted to drugs are someone's child. And they are the very people that are dying of overdoses, but not when they're treated in InSite. Zero deaths from overdoses. And those vulnerable people who are addicted and have this health problem are getting infected with AIDS, which is leads to death, earlier death than, unfortunately, than without AIDS. So those are somebody's child as well who will be dying from the negative impacts of drugs. And with InSite, that transmission is reduced, if not eliminated, because of the prevention of sharing needles.
Honourable Parliamentary Secretary.
Thank you very much, Madam Speaker. The Supreme Court of Canada has made its decision, and again, I'll state, although we are disappointed, we will comply with their decision. Our government believes that spending money on treatment and support to help people get off drugs is the best investment that we can make. This is the most effective way of building safe and healthy communities. The health portfolio alone has invested $577 million over 5 years for its prevention, treatment, and enforcement activities. This represents an unprecedented level of funding for anti-drug initiatives by our government and reflects our commitment to the individuals, the families, and communities affected by drug use. We will also continue to work with provincial, territorial, and municipal partners to address the use of drugs in the downtown east side of Vancouver and across Canada. And I think everyone knows, Madam Speaker, prevention is the best strategy. Thank you very much.
The honourable member for